Hey there, welcome to the Stella Life Innovators series. I'm Liz Lundry, and today we are so happy to have a conversation with Dr. Robert Heller. Dr. Heller is a noted author and international speaker as an implant specialist. He's the co-director of the Midwest Implant Institute, which has helped 7 dental schools develop their implant programs and has taught thousands of doctors to become dental implant surgeons. The Institute provides numerous courses for dentists, ranging from implant placement to advanced bone grafting, lateral nerve repositioning, sinus elevation, and more. Dr. Heller maintains a private practice oriented to implant surgery and related prosthetics. Welcome, Dr. Heller.
Welcome. Thanks for allowing us to be here. This is what a great day. Nice little cool, cheery day here in Columbus, Ohio.
Yeah, that's right. Yeah, same thing up here in the Bay Area. A little dreary, but spring is coming, right?
Can't
So
wait.
yeah, right. Thank you so much for taking the time to speak with me today. So I wanted to ask you a few questions about what you do. And, what's really amazing is the Midwest Implant Institute was America's first implant institute, teaching dentists how to place implants. So you're pioneers. Can you describe your father's vision to found MII and your memories of its early stage beginnings?
I'd be happy to. I was 7 years old when he placed his first implant. I didn't know he was doing that, but that was something that when I look back on, it amazes me that at such a young age that he was in his 30s and here I was 7 years old and he was doing something that little did I know was going to turn out to be a really pioneering type of procedures that would be able to take somebody from wearing something removable to wearing something that is now fixed. We've had the good fortune of watching the technology go from having success rates in the 70th percentile to now into high 90 percentile. And Dad just saw a vision that would enable us to be able to take somebody that was a dental cripple and be able to create a scenario where they can now bite and chew and eat. And it's really fortunate to be able to follow in his footsteps and know that we're just keep beating down that path to try to keep helping more and more and more people.
Yeah, absolutely. He was really a visionary and he saw where this was going to go, where I've been a hygienist for over 40 years. And, early on implants we weren't seeing as many, and now it's much more common because the need is huge. So what you're offering doctors to be able to do this for their patients is just tremendous, really improving people's lives. So please tell us a bit about the courses that are currently offered at MII and the MII Life Signature Series on Fridays.
Awesome. So Dad started teaching really in the 70s as the Ohio Implant Institute with Dr. Jack Hahn. And in 1980, they decided that it shouldn't be just Ohio to experience implant dentistry, and they wanted to reach out to the other doctors in the Midwest. So it was really kind of formed to where we could bring in doctors from other states or individuals from the state of Ohio to be able to bring your own patient, work on your own patient. And really the idea was to be able to treat your patient from start to finish, not just go in and do the surgery, leave the patient be, and then you never see the patient again. So the idea behind this has always been for the last 40 plus years is to bring your patient into our office, you treat them, you take them home, you take the sutures out 2 weeks later, and then follow through with the potential complications, with the success, and then also to then follow through with the restorative dentistry. Early on, it was a lot of specialists that were really trying to get into implant dentistry because they saw where this was going to go. Now, probably for the last 30 years, predominantly we've trained general dentists. The specialists are getting the training in their respective residencies. But right now, what we try to do is to bring the doctors into our initial course. We teach them for over the course of 3 days what we would do from a diagnosis treatment planning standpoint, then be able to take them from start to finish with an initial surgery that typically is either a healed site or it could actually be an extraction site, but we prefer the initial surgery that they do be a healed site. So that really is the initial introductory course. Then we have our prosthetic course that is a 2-day course or a day and a half, where we bring in local docs that want to learn the restorative process. We have a laboratory that we work with quite regularly, and we then work with the lab then to help the doctor understand all the pieces and parts and everything that's necessary to go from A to Z, from a single tooth restoration all the way to an all on X type of restoration. Also being whether it be fixed and or removable. We also have a digging out of problems course, which I think is something that my dad also kind of pioneered back in the 80s, because he realized that as successful as we were, we still had some failures. And we had to recognize those, admit those failures, even though we don't like saying, hey, there's a possibility that this might not work. Back in the 80s, it was a real possibility that 2 out of 10 of these implants didn't work. Now we're able to say that 9.5 out of 10 or 9.8 out of 10 are going to work almost every single time. But there are those small little pitfalls that each surgery potentially can have. And so we have to learn how to handle those pitfalls, be it from healing to incision lines opening. And then I think one of the biggest ones is the psychological, if you will, from a patient perspective, being able to handle that patient that is very simple all the way to the very, very difficult. Knowing who's sitting in your chair is as important as knowing who isn't sitting in your chair. So then we also have our advanced bone grafting course. So we will then do the ability, we're going to then teach a course that will show you how to do everything from just a simple onlay graft with implant placement to extract, graft, and implant, all the way to sinus elevations, advanced onlay grafts with membranes, advanced onlay grafts with titanium reinforced membranes, and then also our sinus elevations and lateral nerve repositionings, if you want to get to that level. We also teach a brand new course that's a business course. I'm very, very proud of my daughter, Samantha. She's decided that this is something that, as we have seen our externs come through, one of the questions, or many of the questions that she's getting, is not really related to the dental aspect, but it's the aspect of dealing with the finances, dealing with the front staff, the back staff, and the front staff, and all the different interactions that happen in a dental office in relation to implant placement. So that really is the crux of the courses we're teaching right now. We're looking at potentially trying to add a couple more in the future, which would entail an all-on X type of course, and we've taught a couple of PRF courses, but there are so many different ones that are around the country right now that we kind of just keep that to a minimal, if you will, during our bone grafting course, and let the experts come in and handle that. We're very, very fortunate to have another campus that is down in Louisville, Kentucky, that Dr. Eric Nunnally runs. They've got an introductory course down there, as well as we combine our digging out of problems and pros course down there as well. So we teach one down in Louisville, and then one up here in Columbus, and that's really been very, very nice for us. So we get a little bit different flavor of teaching, and that enables people to get different perspectives.
That's so empowering for the doctors, to support them the way that you do with the problem solving as well. And then I love the idea of having that business support. I've been an in-office trainer and consultant for 30 years myself, and you really need to have the whole team on board, being able to answer patients' questions and really understanding, what's happening in the operatories to really support those patients. So that's really wonderful that you're providing all that for the entire team as well, for the clinicians, for the doctors. So, since the founding of the Midwest Implant Institute, there are now many more institutes that are teaching implant placement. So what is unique about MII and the experience that doctors will have there, and how does it differ from similar organizations?
It's such a great question. Being the first was obviously a privilege that we really hold near and dear to our heart. One of the things that I think really separates us is, number one, you're going to be treated like a family member. We really do want to mentor you. It's a lifelong mentorship. It's not just come in, pay us a fee, and then we train you, and then you're gone and never heard from again. One of the things that I think is key in this is we train your staff. You can't take our courses unless you bring your staff members. And so if you are in the middle of working through different cases and all of a sudden you lose a staff member, we need to make sure that we're going to help you train another staff member. So oftentimes we'll have offices that have gone through 5, 10, 15, 20 years, and now they need to have a staff member trained. So we'll have doctors call us up and request that they come in and learn the process of start to finish of setting up an operatory, setting up a sterile technique, a sterile drape, and those sorts of procedures that are very, very commonplace in an implant dentistry practice. The other thing is, I really think that from inception, we've kept a sterile technique type of setup. My dad did some studies way back in the 80s with the microbiology department down at Ohio State, and they really couldn't believe that we could get the mouth sterile during an implant procedure. And that leads us to where we are with Stellalife. We started out with povidone iodine that was really good. It's horrible tasting. People didn't like it. It stained the tissues. And then we did switch over to chlorhexidine, which was a product that we used for quite some time for those that were allergic to the iodine products. But now through some research that Stellalife has gone through with some universities, we're finding out that it's harmful to the surgery site. It's harmful to tissue. It's harmful to bone. And so if you look at the periodontal literature, they're not seeing that. But when we start looking at trying to reflect tissue, trying to expose bone, we need to have a product that won't harm fibroblasts. And so we have switched our entire protocol for our sterile technique from the chlorhexidines, the povidone iodine, all the way to now we're rinsing the patient out with Stellalife. And then we're following that up with the Stellalife gel, the Stellalife spray, and that is then also helping decrease the post-operative pain, post-operative swelling, And it's just a much, much, much better experience for our patients. The thing that's really nice about us is you're coming in, you're bringing your patient, and you're then going to leave with your patient and follow things through from start to finish. And I think that's really what sets us apart. We have changed the Dental Practice Act here in Ohio way back in 1982. So if you are an out-of-state doctor, you can come in and get a temporary Ohio license for a year. And then if you need an additional year, we can get that renewed for an additional year. Hopefully, a lot of those barriers are being broken down and we'll be able to practice wherever we want. But right now, we're able to bring in any doctor from out of state and be able to provide that teaching service for them.
That's really excellent. So you have so many options there, and I really want to commend you for trying the Stella Life. We now are getting more and more research done showing that it does not harm the osteoblast or the fibroblast. It encourages the growth of the fibroblast to help all the doctors get better results, whether they're using PRF or not, just to accelerate that healing. And as you've observed, more comfort for the patient. So thank you for that and for helping other doctors learn about that. But it really sounds like such a wonderful program supporting the doctors in so many ways and letting them do this right here in the US, with the licensure that you've enabled them to have. So thank you for everything that you're doing. You are improving people's lives, and that's really what it's all about. So I want to thank you for everything you're doing, and thank you so much for spending some time with us today and sharing this information. So we really appreciate you, Dr. Heller, and the Midwest Implant Institute. And for everybody out there joining us today, please come back as we continue to speak to more amazing individuals who are really helping to make a difference in people's lives, such as Dr. Heller. And until then, please take care of yourselves, stay well, and stay happy. Thank you so much.
Thank you very much for giving us this opportunity to speak with you as well. We really do appreciate your company and your products. And like I said, we use them on a daily basis, not only just in our surgery practice, but all of in our perio department as well, to make sure that that's helping decrease inflammation and decreasing swelling. And again, patients just are raving about the products and how much better their tissues feel.
And it tastes good too.
And it tastes good too.
Nothing wrong with that. So
we're coming out with more flavors all the time.
Yes, we are. And thank you again so much. And everybody out there, take care and see you very soon. All right. Goodbye.
Bye.